Paul Njoku, step away from the workstation, keep your hands visible.
What's the problem here?
We're conducting a federal investigation involving patient records and Medicare documentation.
This is Paul Njoku, the owner of a Houston home health agency who billed Medicare hundreds of thousands of dollars using forged signatures he cut out with scissors and taped onto fabricated medical records. His fraud is about to catch up with him.
Those records are handled by multiple employees.
Please remain where you are.
All right.
He would not get the chance to explain it away. Within hours, federal agents would carry sealed evidence boxes from the offices of Opnet healthcare services in Southwest Houston. Inside those boxes were doctors' orders, nursing assessments, and patient files. And taped onto many of them were signatures that had been cut from older paperwork with a pair of office scissors. 5 years, $400,000 billed, $360,000 collected. One registered nurse whose name kept appearing on documents 2 full years after she had quit. Paul Chinedu Njoku had built a Medicare-funded home health agency out of paste and patience. And a jury would need less than 2 hours to take it all apart. This one hit different when I found it. If you think you know where this is going, drop your prediction in the comments. And subscribe, because I promise you, you are wrong. We cover cases mainstream news ignores every single week, and the full story is worse than the headline. Paul Chinedu Njoku was born in 1960 in Mbaise, a town in Imo State in southeastern Nigeria. His father ran a small dry goods shop, selling rice, palm oil, and kerosene to neighbors out of a one-room storefront. His mother kept a treadle sewing machine on the front porch and took in seamstress work from women in the village. They were not poor, but they were not far from it. Paul was the second of 7 children. He learned early that paperwork mattered. His father kept handwritten ledgers in a brown cloth-bound book, tracking who owed what. And by the age of 10, Paul was the one who totaled the columns at the end of each week. Numbers came easily to him. Discipline did not. Teachers at the local primary school described him as quick with figures and respectful with elders, but easily distracted and prone to talking his way out of trouble. He attended secondary school in Owerri. He wanted to be a doctor. The family could not afford medical school, so in 1979 he sat for entrance examinations and was admitted to the University of Lagos to study business administration. He graduated in 1983 with a degree and very little idea of what to do with it. Nigeria's economy was collapsing under falling oil prices. His older brother had already emigrated to the United States and was working at a hospital in Atlanta as a respiratory therapy aide. The brother sent letters back to Mbaise describing American wages, American apartments, and American grocery stores. Paul read those letters by lamplight and made up his mind. In 1987, Paul Njoku boarded a flight to Houston on a student visa. He was 27 years old. He carried 2 suitcases, $400 American sewn into the lining of a jacket, and the phone number of a Nigerian church on Bissonnette Street. He moved into a 2-bedroom apartment in a leaf shared with 3 other men from Imo State. He enrolled at Houston Community College and started taking classes in accounting and health administration. He paid for school by working overnight shifts as a nursing assistant at a long-term care facility in Stafford, lifting patients out of beds, changing soiled linens, and learning, slowly, how American healthcare paperwork actually moved. He met Patience Easy in 1990 at a wedding reception in Missouri City. She was a labor and delivery nurse at Ben Taub Hospital, born in Njoku, raised partly in Houston. They married in 1992 at a small ceremony in a community hall on West Belfort. Their first daughter was born in 1994. Their second in 1996. A son followed in 2000. By the late 1990s, Paul had earned a certificate in healthcare administration and was working as a billing specialist at a small medical group in Southwest Houston. He learned how Medicare reimbursement codes worked. He learned which forms got paid quickly and which ones got kicked back. He learned that the entire machinery of American home healthcare ran on paper, and that paper, if you understood it, was the same as money. In 2010, with savings, a home equity loan against the family's Sugarland house, and a co-signed line of credit from his older brother in Atlanta, Paul Njoku incorporated Opnet Healthcare Services, Incorporated. He registered it with the Texas Department of Aging and Disability Services, obtained a Home and Community Support Services Agency license, and enrolled the company as a Medicare provider. He named himself President, Chief Executive Officer, and Director of Operations. The company did business as P&P Healthcare Services. The two Ps were Paul and Patients, although Patients had no operational role. For the first 3 years, Opnet did what it was supposed to do. It contracted with licensed home health nurses. It accepted patient referrals from primary care physicians. It billed Medicare for legitimate visits. Paul drove a 5-year-old Toyota Camry, took his kids to soccer practice on Saturdays, and tithed at his Nigerian-American church on Sundays. By 2013, Opnet had 31 patients on its rolls and revenue just under $900,000 a year. He told his wife the company would put all 3 children through college without loans. But the home health business was getting harder. Reimbursement rates were tightening. Medicare auditors were getting more aggressive. Documentation requirements were getting longer and more specific. And Paul Njoku had taken on more overhead than the legitimate margins could carry. Medicare home health is a paperwork business pretending to be a medical one. The actual care happens in a patient's living room. A nurse comes in, checks vitals, dresses a wound, helps with a shower, leaves. The visit takes 30 minutes, but the documentation it generates can run to 12 pages. For Medicare to pay, 4 things have to exist on paper. A face-to-face encounter with a physician within 90 days before the start of care. A signed physician's order, called the 485, certifying that the patient is homebound and that skilled nursing is medically necessary. A comprehensive initial assessment performed by a registered nurse within the first 48 hours, and a series of nursing visit notes documenting every interaction with the patient. The system runs on signatures. The physician's signature on the 485 says, "I, a licensed Texas doctor, examined this patient and determined that she needs home health." The registered nurse's signature on the assessment says, "I, a licensed Texas nurse, evaluated this patient in her home on this date, and these are her clinical needs." Without those 2 signatures, Medicare does not pay. With them, Medicare pays roughly $3,000 per 60-day episode of care, per patient, automatically. Medicare does not verify those signatures up front. The agency submits a claim. The claim is processed. The money is wired. The signatures sit in a file cabinet in the agency's office, waiting for an audit that statistically may never come. The Centers for Medicare and Medicaid Services audits only a small fraction of home health claims. Most agencies will never be asked to produce the underlying paperwork, but when they are asked, the paperwork has to be there, and it has to match. The doctor named on the order has to be a real doctor, currently licensed, who actually saw the patient. The nurse named on the assessment has to be a real nurse, currently employed by the agency, who actually went to the patient's home. The dates have to line up. The signatures have to be authentic. This was the system Paul Njoku spent 20 years learning. He understood every form, every code, every audit trigger. He understood, better than most agency owners in Houston, exactly where the verification stopped and where the trust began. By 2015, Opnet's patient roster had grown to 58. Its annual Medicare billings had crossed $1.5 million. And the documentation backlog inside its small office on Bissonnette Street had grown into something the legitimate staff could no longer keep up with. The scheme started, prosecutors would later argue, in early 2015. It did not start with a master plan. It started with a single missing 485. A patient had been on service for 45 days. Opnet had billed Medicare for 2 visits a week. The money had arrived. But the physician who was supposed to have signed the original order had retired and moved to Florida. Opnet's office manager, a woman named Njoku, brought the file to Paul. The doctor was not returning calls. The order needed to be in the chart by the end of the week. There was a Medicare audit request sitting on Paul's desk. What Paul did next was the moment everything began. He pulled an older 485 from a closed file, one the same physician had signed 8 months earlier for a different patient. He carried it to a small workroom in the back of the office. He took a pair of office scissors. He cut the signature out. He laid it onto a freshly typed order for the current patient, and he taped it down with a strip of clear cellophane tape, then ran the document through the office photocopier. The photocopy looked, at a glance, like an original. The tape edges disappeared in the reproduction. The signature lined up where a signature was supposed to be. He submitted the copy to Medicare. Medicare accepted it. The audit closed. He had crossed a line, but nothing had happened, so he did it again. By the end of 2015, the scissors and tape were not a one-time fix. They were a system. Paul kept a manila folder in the bottom drawer of his desk. Inside the folder were signatures cut from old, legitimate paperwork, organized by name. Doctors he had once contracted with. Nurses who had worked for him at various points. A small archive of clipped signatures, taped to a master sheet, waiting to be cut out again and reused. The operation escalated. By 2016, Opnet was generating forged documentation on a routine basis. Adaeze Nwosu testified later that Paul instructed her, in person, to fabricate nursing visit notes for patients she had never met. She would type the notes on agency letterhead, fill in plausible vital signs, plausible wound measurements, plausible clinical observations, and then bring the typed notes to Paul. Paul would attach a cut-out nursing signature from his folder, photocopy the result, and place it in the patient's chart. In 2017, a registered nurse named Lorna Whitaker resigned from Opnet. She had worked for the agency part-time for about 18 months, performing initial assessments and supervisory visits. She gave 2 weeks' notice in March. She returned her badge. She cleaned out her cubicle. She walked out the front door of the Bissonnette Street office on a Friday afternoon and did not look back. Paul Njoku kept using her signature for the next 2 years. Through 2018 and into 2019, nursing assessments bearing Lorna Whitaker's name continued to flow out of Opnet. Patients she had never met, in homes she had never visited, in zip codes she had never driven to. Her signature, cut from a pile of her old paperwork, taped onto fresh assessment forms, photocopied, and submitted to Medicare. She had no idea the bribery began around the same time. Paul needed a physician willing to certify patients he had not personally examined. He found one. The doctor, a Houston area primary care physician whose name was later redacted from court filings, agreed to sign blank 485 forms in exchange for cash payments delivered in envelopes at his office. The arrangement was simple. Paul would type the patient information. The doctor would sign. Paul would pay. Neither of them had to see the patient. From 2015 through 2019, Opnet billed Medicare more than $400,000 in claims supported by forged or fraudulent documentation. Medicare paid out more than $360,000. Much of the money flowed through Opnet's operating account at a Wells Fargo branch in Sugar Land and into Paul's personal accounts, his mortgage, his children's college tuition at universities in San Marcos and Denton, and a black Mercedes E-Class he leased in 2017. Inside the Bissonnette Street office, the legitimate staff slowly began to notice. A new nurse asked, in 2018, why Lorna Whitaker's name was on assessments for patients she had never seen Lorna in the office to discuss. Adaeze gave a vague answer. Paul did not give one at all. The nurse left 2 months later. No one called Medicare. No one called the Texas Board of Nursing. No one called the FBI. Not yet. Stories like this do not get the attention they deserve. If you want to see more accountability coverage, subscribe and hit the notification bell. The next part of this case is where it all started to come apart, and you will not believe who pulled the first thread. The end of Paul Njoku's home health agency did not begin with a federal agent. It began with a phone call from a registered nurse named Lorna Whitaker. It was August of 2019. Lorna had been out of home health for over 2 years. She was working as a school nurse at a middle school in Pearland. She had not thought about Opnet healthcare in a long time, but on that August afternoon, she opened a letter from the Texas Board of Nursing. The letter informed her that a Medicare beneficiary's family had filed a complaint regarding home health services provided in 2018. The complaint named Lorna Whitaker, RN, as the assessing nurse on the initial evaluation. The family alleged that no nurse had ever come to the patient's home and that the assessment must have been falsified. The board was opening an investigation. Lorna was being asked to respond within 30 days. Lorna read the letter twice. She had not performed any home health assessments since March of 2017. She had not set foot inside Opnet healthcare services since the day she quit. She did not recognize the patient's name. She did not recognize the address. She drove home that night and pulled her old work calendar from a box in her garage. She had kept the calendar, like she kept most things, out of habit. She confirmed the dates. The assessment in question had supposedly been performed on May 10th, 2018. On May 10th, 2018, Lorna Whitaker had been in Cancun on a family vacation, photographed at a beachfront restaurant with her husband and her 2 daughters. She had the photographs. She had the boarding passes. She had not been within 2,000 miles of Houston. She called the Texas Board of Nursing the next morning. She told them what had happened. She gave them the date of her resignation from Opnet. She told them she had no knowledge of any assessment performed under her name in 2018, and that any document bearing her signature from that period was forged. The board opened a full investigation. They referred the matter to the Texas Attorney General's Medicaid Fraud Control Unit. The Medicaid Fraud Control Unit, after a preliminary review, referred it to the United States Department of Health and Human Services Office of Inspector General. Within 90 days, federal agents were quietly contacting Opnet's former employees. Adaeze Nwosu was the first to talk. She had left the agency in late 2018. She had since taken a job at a different home health company in Pasadena. When an OIG agent named Marcus Holcomb called her, she agreed to meet at a Whataburger off the Gulf Freeway. She brought a manila envelope. Inside the envelope were 3 forged documents she had personally typed, along with a 4-page handwritten statement describing how Paul Njoku had instructed her to fabricate them. The investigation that followed would consume 18 months. It would involve agents from the FBI, HHS-OIG, and the IRS Criminal Investigation Division. It would generate over 6,000 pages of subpoenaed records, and it would end on a Tuesday morning in February of 2021 with 8 federal agents standing at the front door of the Opnet Healthcare Services office on Bisonnet Street. The search warrant was executed at 7:42 in the morning. Paul Njoku was already inside. He had arrived, as he always did, at 6:30 to review the day's billing before the staff came in. He was sitting at his desk with a cup of black coffee and a stack of patient files when the agents knocked. He answered the door himself. Special Agent Marcus Holcomb of HHSOIG identified himself, presented the warrant, and instructed Paul to step away from his desk. Paul complied. Within 2 hours, federal agents had cataloged and seized every file cabinet, every desktop computer, every external hard drive, every binder, and every loose document in the office. They also seized a manila folder from the bottom drawer of Paul's personal desk. Inside the folder, neatly arranged on a backing sheet of cardstock, were 34 cutout signatures. They were taped individually in rows. Each one was labeled in pencil with a name. Some were doctors, some were nurses. Lorna Whitaker's signature appeared 3 times. A retired physician's signature appeared 11 times. The folder was, in effect, a signature library, a reusable inventory of identity theft. The forensic document examiner assigned to the case was a woman named Dr. Janice Pell, contracted from a federal lab in Washington. She spent 4 months working through the seized paperwork. She reassembled, physically, the original documents from which signatures had been cut, and matched them to the forged versions where those same signatures had been pasted. In some cases, the cut edges aligned perfectly, as if completing a jigsaw puzzle. In others, the photocopier's slight enlargement of the copied signature was detectable under magnification. Dr. Pell ultimately identified 147 separate documents inside Opnet's files where a signature had been cut from one document and affixed to another. She identified another 62 documents where the signature appeared to have been traced from an original. She produced a written report 211 pages long. The financial investigation, led by IRS Special Agent Caroline Vesper, traced more than $360,000 in Medicare payments through Opnet's accounts and into Paul Njoku's personal expenditures. A home equity line of credit paid down, tuition payments to a private university in San Marcos, lease payments on the black Mercedes, a renovated kitchen in the Sugarland house. None of it was hidden. Paul had not bothered to launder the money. He had simply spent it. Lorna Whitaker was interviewed for over 4 hours. She produced her old calendar, her boarding passes, her vacation photographs, her cell phone records, her resignation letter from March of 2017, and her badge return receipt. She walked the agents through every document bearing her signature from her actual tenure at Opnet, and then through every document bearing her signature from the period after her departure. The before and after were indistinguishable to a casual reader. To Lorna, they were unmistakably different. The forged signatures had been cut from a single source document. The same pen pressure, the same slight rightward slope, repeated again and again across 2 years of fabricated assessments. The bribed physician, confronted by agents in March of 2021, agreed almost immediately to cooperate. He provided cash receipts, signed statements, and recorded phone calls with Paul in exchange for a plea agreement on a lesser charge. He testified that he had signed approximately 80 blank 485 forms over a 2-year period in exchange for cash payments totaling around $24,000. Text messages recovered from Paul's phone were sparse but damning. Paul Njoku, March 14, 2018. Bring the forms by tonight, same as before. I will have your envelope ready. Doctor, March 14, 2018. On my way at 7. Paul Njoku, October 2nd, 2018. Need 3 more this week. Patients listed on the cover sheet. Doctor, October 2nd, 2018. Okay. A federal grand jury in the Southern District of Texas returned a sealed indictment in November of 2022. Paul Njoku was arrested at his home in Sugarland on a Wednesday morning in November of 2022. 6 federal agents arrived at 6:58 in the morning. Patience Njoku answered the door in a bathrobe. Paul came down the stairs in slacks and a white undershirt, holding a cup of coffee. Special Agent Marcus Holcomb identified himself. He told Paul there was a federal arrest warrant. He told Paul he was being charged with conspiracy to commit healthcare fraud, false statements relating to healthcare matters, and aggravated identity theft. He read Paul his rights. Paul set the coffee down on the entryway table. He looked at his wife. She was crying. He looked at the agent. "This is about a Daz," Paul said. "She did this. She is the one who signed those papers. I trusted her with the office. I did not know what she was doing." Holcomb did not respond. "I am the CEO," Paul continued. "I do not handle the day-to-day paperwork. That is the job of the office manager. If there are forged documents, those came from her, not from me." "Mr. Njoku, we have a warrant. You can address all of this with your attorney. You will find that I had nothing to do with this. I am being framed." "Sir, turn around, please. Put your hands behind your back." Paul turned. The handcuffs clicked. Patience was on her knees by the entryway table, sobbing. Paul looked back at her once, over his shoulder, as the agents walked him out the front door. He did not say anything else. He was processed at the federal courthouse on Rusk Street in downtown Houston. He was released on a $100,000 unsecured bond pending trial. He did not return to the Opnet office. The company had already been suspended from Medicare. There was nothing left to run. Paul Njoku was indicted on 8 federal counts. 1 count of conspiracy to commit healthcare fraud under Title 18 of the United States Code, Section 1349. 4 counts of false statements relating to healthcare matters under Title 18, Section 1035. 3 counts of aggravated identity theft under Title 18, Section 1028A, for the unauthorized use of Lorna Whitaker's name and signature. His defense attorney was a Houston solo practitioner named Reginald Kane. The defense strategy was straightforward and, ultimately, doomed. Kane argued that Paul Njoku was a Nigerian immigrant who had built a legitimate business and had been let down by a dishonest office manager. He argued that Adaeze Nwosu had created the forged documents on her own initiative and had concealed them from Paul. He argued that the manila folder of cutout signatures in Paul's desk drawer had been planted there by someone else. The trial began on a Monday morning in May of 2025 before United States District Judge Alfred H. Bennett. The government's case-in-chief lasted 2.5 days. Adaeze Nwosu testified for 3 hours. She walked the jury through the workflow of the forgeries, naming Paul as the originator of every fabrication and identifying his handwriting on the labels of the signature folder. Lorna Whitaker testified for 90 minutes. She produced her resignation paperwork, her vacation photographs, and her sworn statement that she had not authorized a single document submitted under her name after March of 2017. Dr. Janice Pell testified for nearly a full day, walking the jury through reassembled documents projected onto a large screen. She showed jurors physical exhibits in protective sleeves where the cut edges of one signature aligned precisely with the gap left in the source document. The visual was devastating. Several jurors leaned forward in their seats. 2 took notes furiously. The defense rested without calling Paul Njoku to the stand. The jury received the case at 3:48 on a Wednesday afternoon. They returned a verdict at 5:32 the same afternoon. Less than 2 hours of deliberation. Guilty on all 8 counts. Sentencing was held 3 months later. Lorna Whitaker delivered a victim impact statement to the court. She told Judge Bennett that for 2 years, a man she had never harmed had used her name to steal from a federal program meant to care for the sick. She told the court that her professional reputation, built over 15 years of clinical work, had been borrowed without her permission and dragged through fraud. She told the court she still received occasional letters, even now from patients she had never met, written by family members who believed she had been their loved one's nurse. "He erased me from my own signature," she said. "He kept signing my name after I was gone, as if I were just a piece of paper he could photocopy. I want the court to understand that this was not just fraud. This was theft of a person." Judge Bennett spoke for nearly 15 minutes before pronouncing sentence. He addressed Paul directly. "Mr. Njoku, you were a Medicare provider. You were entrusted with public funds in exchange for documentation that the care you billed for had been ordered by a physician and assessed by a nurse. You did not provide that documentation. You manufactured it. You did so with scissors and tape in your own office, in the bottom drawer of your own desk, over a period of years. You used the name of a nurse who had left your employ, without her consent, repeatedly, for 2 years after she walked out your front door. You bribed a physician to sign blank orders for patients he had never seen. You did all of this not in a moment of desperation, but methodically, over time, as a chosen way of doing business. The court finds your conduct deliberate, sustained, and gravely corrosive of the public trust on which Medicare depends." He sentenced Paul Njoku to 75 months in federal prison, followed by 3 years of supervised release. He ordered restitution to Medicare in the amount of $361,482. He ordered the immediate surrender of Paul's home health agency license and any associated provider numbers. Paul Njoku was remanded to federal custody at the conclusion of the hearing. He was designated to the Federal Correctional Institution at Beaumont Low, a low-security facility in southeast Texas, where he is scheduled for release in 2031. His wife, Patience, filed for legal separation 7 months after sentencing. Opnet Healthcare Services Incorporated was permanently barred from Medicare and Medicaid participation, and its corporate registration was forfeited to the state of Texas. Adais Njoku received probation and a cooperator's reduction. The bribed physician received 18 months and surrendered his Texas medical license. Lorna Whitaker still works as a school nurse in Pearland. The Texas Board of Nursing closed its investigation into her conduct in 2023 with a finding of no fault. She has, in the years since, occasionally been asked to speak at home health compliance seminars about the day she opened a letter from the board and discovered that her own signature had been outliving her career, taped onto fabricated documents in an office she had quit 2 years before. This case was disturbing. But this next case on the right-hand side is even more shocking. Click it now. Click it.